Hey there, I'm Joshua Johnson. Good to be with you tonight from NBC News World Headquarters in New York. Bars are closing in Louisiana, and Disney World is opening in Florida. Two very different turning points as the coronavirus outbreak continues growing. Today, Florida recorded 15,300 new cases. It is the highest one-day total in any state since the pandemic began months ago. No wonder Central Florida's theme parks are turning away guests without masks. We'll focus on Louisiana later in the hour. COVID-19 cases are increasing in most of the country. More than 36 states are seeing an increase. Hospitalizations and deaths also continue rising. All told, the U.S. has more than 3.3 million confirmed cases and almost 136,000 known deaths. These statistics can easily feel disembodied and faceless. They just keep growing with no end in sight. But one face of the fight against COVID-19, working to stop its growth, is becoming a more direct target of the White House. It provided NBC News with a list of about a dozen comments it says that Dr. Anthony Fauci was proven wrong on. The document resembled the kind of political opposition research that a candidate would release about their opponent. The points against Dr. Fauci included his comments in January that coronavirus was not a major threat and not driven by asymptomatic carriers. Also mentioned, Fauci's comment in March that people should not be walking around with masks. Now, those assertions did turn out to be wrong as we learn more about COVID-19. Still, polls show that Anthony Fauci is mostly trusted across the political spectrum. He has not been on TV in a while, but other administration officials made the Sunday morning rounds today, including the Surgeon General.
So just as we've seen cases skyrocket, we can turn this thing around in 2 to 3 weeks if we can get a critical mass of people wearing face coverings, practicing at least 6 feet of social distancing.
Now, he makes a good point. That is a solid plan to turn this thing around, if we would all do our part. Meanwhile, Education Secretary BETSY DEVOS shared no definitive plan to reopen school campuses this fall, but she insisted they need to open.
If there's a short-term flare-up for a few days, that's a different situation than planning for an entire school year in anticipation of something that hasn't happened. That's a very different thing. Kids have got to be back in school. They've got to be back in the classroom. And working families have to have their children in school.
Okay,
and knowing that they're continuing
I know
to
you keep
advance in their
that kids
learning.
should be back in school. Nobody is disagreeing with that.
CDC guidelines note that online classes pose a low risk of infection. DeVos would not say whether schools should follow that guidance. Coronavirus gives us lots to discuss with our first panel. Joining us this evening, Dr. Lipi Roy, an internal medicine physician and an NBC News medical contributor. Kimberly Atkins, senior Washington correspondent for WBUR Public Radio in Boston and an MSNBC contributor. And Jonathan Allen, senior political analyst for NBCnews.com. Dr. Roy, let me start with you. First of all, it's good to be with you from a safe distance of at least 6, this looks like at least 7 or so.
He's almost 10 feet, isn't it?
I know, it's like being in a real place again.
I'm also metric, I'm Canadian, so I don't know, but it's definitely over 6 feet, man.
We're 2 meters at least. I want to get your reaction to a little bit more of what the Surgeon General, Jerome Adams, said. Let's play this clip and then get your thoughts on the other side.
Once upon a time, we prescribed cigarettes for asthmatics and leeches and cocaine and heroin for people as medical treatments. When we learn better, we do better. And the WHO,
are you saying
the CDC,
at that time you did not know because the CDC in February was looking at asymptomatic transmission of the virus?
We were looking at that, but the CDC, the WHO, and even in May, there was a New England Journal of Medicine article that still disputed whether or not masks were effective.
Now, that seems like a weird comparison. The cigarette industry had a lot to do with the junk science about the supposed health benefits of cigarettes. Leeches are still used in medicine in some applications today, and there is research behind that. And I won't even start on cocaine and heroin. That just seems like a really weird comparison.
Right. My impression of what the Surgeon General was trying to say is that data is constantly changing and evolving. It's not that Dr. Fauci was necessarily wrong. He was going by the data or the lack thereof. And I just want to go back to a segment that you were just airing earlier. if I may just set the record straight here and make sure there's no confusion, Dr. Fauci is a gentleman who has devoted his life and his career to the health and well-being of the American people. He is so well respected around the world. Think about it this way, Joshua. If you or any of our viewers had a question about their diabetes or thyroid or lupus medications, do they call their mayor or senator or governor or the president, or do they call their doctor? Similarly, we are in the midst of a medical health crisis. We should be listening to these career scientists and researchers and doctors like Dr. Anthony Fauci.
Jonathan, we know that President Trump and Dr. Fauci have not seen eye to eye. Recently, you tweeted, and I'm paraphrasing, a conventional rule of politics: you don't fight with someone who's not on the ballot. But Donald Trump so far has defied everything that he used to be considered a rule or a convention of politics or a law of political gravity. What about this one?
Yes, it's a great point that you make. He's somebody who has attacked people within his own administration. He's attacked Khazar Khan and Judge Curiel in the last election. But I think he won despite those things, not because of them. When you're fighting somebody who's not on the ballot, you're distracted from your opponent. In this case, Anthony Fauci's approval ratings could conceivably come down, but it's not necessarily going to help Donald Trump's approval ratings for that to happen. I think he probably does see Fauci as somebody who's in opposition to him, and it's hurting him with his base. Right now, what we've seen from Trump is an erosion of his base for the first time. Not in huge numbers, the vast majority of them are still with him, but we're starting to see college-educated white women, college-educated white men, older voters starting to pull away from Trump. And I think he must be trying to figure out a way to discredit Fauci with this opposition research campaign to try to get some of them back. So that they're not listening to Fauci, so that they don't become more alienated from the president himself. And just one other thing, I'm not a doctor, but if I'm not mistaken, cocaine and at least opioids, if not heroin itself, are still very much used in medicine.
Is that true, Doctor?
Actually, yes. Even though heroin is considered a Schedule I drug, there are actually places in the world that use heroin to treat opioid use disorder.
The more you know. Kimberly, with regards to Secretary DeVos's appearance today, we know that President Trump likes positive TV appearances from his officials or appearances that seem to go well. How do you think that today's appearances by Secretary DeVos rated with the White House?
Well, if the scoring criteria is staying on message that schools, like businesses, like the economy, must reopen no matter what, she did exactly that. She didn't always stay along the lines of common sense that if schools don't have a plan of how to reopen safely in a way that doesn't put on not just the students, but also teachers and everyone else in that building that works in a way that doesn't put them in danger, then that's not going to accomplish your purpose. Her message today was clear: open up or else. As to how to do it safely, it's up to the local school departments to figure that out on their own. But opening schools is essential to reopen the economy, and we've seen from the president that that is his top focus. He wants this virus to go away. He has repeatedly said falsely that this virus will go away. And despite the fact that we have seen more new cases in the last few days than ever, that plan is being pushed to move forward. And it seemed that Secretary DeVos is staying in line with that.
Before we move on, Dr. Roy, there was a very upsetting story of a 30-year-old man in Texas who apparently attended a COVID party, what some are referring to as a pandemic party, and died. The chief medical officer at a hospital in San Antonio says that as he died, he said regretfully that he thought COVID-19 was a hoax. Now, I don't see any value in speaking ill of the dead. This is somebody's son who's dead today. And we don't know yet how widespread these so-called pandemic parties are. They're shocking, but they might be rare. We really just don't know. What do you think the proper response to these should be? I don't think that shaming people or wagging fingers at people will do any good, but what might do some good?
First of all, I'd like to just express my condolences to this gentleman and his family. You're absolutely right, Joshua. Each person that passes away, when we think of these numbers of 130,000, it's almost unfathomable, right? But as a doctor who has actually seen people struggling to breathe, struggling to live, and writhing in pain in hospitals, and right now with this pandemic, they are by themselves in a sterile hospital room because, as you know, visitors aren't allowed, loved ones aren't allowed. So when I think of these individual people struggling, going to parties, thinking that it's not going to affect them, I have to channel the legendary Carole King. It chills my soul to the marrow. And you're absolutely right. And certainly in medicine, we try not to use shame because we know that's not an effective strategy. I look at it from 2 points of view. One is young people just have this sense of invincibility that's not going to affect them, but also it's a sign of lack of leadership. You need to have strong messaging from leaders saying, look, this is real and this is how you can protect yourself. I do not leave my home without wearing a mask. Leaders need to be wearing the mask, mandating the mask, and mandating physical distancing in order to save lives.
I think at the very least, the shame aspect of this whole pandemic is a topic for another day. But you're right. I don't see how that would do any good. We'll see what will ultimately do good in preventing some of these pandemic parties. Dr. Lipi Roy, always good to see you. Thanks very much.
You too, Joshua.
Kimberly, Jonathan, do stick around. We'd like your help later on in the hour. But for now, we're continuing.